My name is Anica Mikuš. I am a retired child psychiatrist and the consultant in the program School-Based Psychosocial Assistance to Children in Ukraine. My task is to briefly present the program. We all know that each war affects emotionally the well-being of thousands and 10,000s of children and youth exposed to extreme traumatic events and losses. The question is how to provide help, assistance, support to these children, how to help them to cope with war-related wounds and to recover. It is obvious that clinical models are not appropriate and efficient in this situation or situations of mass disasters. And on the other side, we know that millions of children who experienced wars and huge suffering in past times in history recovered without professional help of mental health specialists. The project School-Based Psychosocial Assistance to Children in Ukraine is aimed to reduce suffering of children and help them to overcome war traumas and losses and prevent long-lasting mental health disorders with the aid of natural resources from their life environment. Therefore, a school and community-based program will be developed. School workers and volunteers will be encouraged, motivated, instructed to provide assistance in everyday life circumstances of classes, schools, kindergartens, leisure time activities like playing sport, art and other activities. The advantage of the program is that it provides a basic support and assistance to a huge number of children in the social tissue of the schools, which are embracing all children. It is implemented in the already existing universal institutional structure, the educational system. Knowledge, skills, experience acquired by school workers and volunteers included in the program have a sustainable values. They will be needed and useful in the post-war period as well. We are aware that there are children who would need clinical therapeutic assistance for their mental health problems, and we hope that at least for a part of them, this help will be eventually provided. Unfortunately, even in rich countries without wars, a huge number of children with mental health disorders remained without adequate therapeutic help due to the enormous gap between needs and available professional resources. School-based programs are nowadays widely used for psychosocial assistance in areas affected by armed conflicts. The Slovenian implementing team has good previous experiences with similar programs in other countries. But the greatest burden and responsibility for the productive implementation of the program certainly lays on local partners, school, NGOs, and other agents, and the merits for the achievement of the program goes to them as well. Now let me present very briefly the activities of the program. The program will be run in Ismail, the region of Ismail, which is on the south, in the south of Ukraine. It will last 2 years. The first activity will be 3 days lasting training for trainers, local trainers. Local trainers will be professionals close to the mental health field or from the mental health field. And in these trainings, they will be prepared to work with teachers and to run trainings, seminars for teachers for preparing them to assist their students. The next activities are 3 trainings, 3 seminars for teachers. There will be 100 teachers altogether included in this program. from 24 schools. Training for teachers will last also 3 days. After each training, they will go back to schools and implement the program. Implementing the program means to help children, to provide some assistance to parents, to develop voluntary work in the frame of the school as a way of peer assistance to children and to activate resources in the community. And then there is another important activity. Trainers will visit included schools and run lectures or workshops for all teachers of included schools, so that the minimum of knowledge on psychosocial topics will be transferred to all school workers. Activities of volunteers is another very important innovation which will be organized in the frame of the program. Aims of training of teachers will be to help them to cope with their own job-related and war-related problems, because they also are traumatized and experience losses, to encourage, motivate them and empower them to provide basic psychosocial support and assistance to their students, to enrich their knowledge and experience in the psychosocial field. Concerning the methodology, there will be short lectures, but the accent will be on group work, role-playing, and other methods of interactive learning. We will discuss mainly what can be done for children and their parents in the reality of everyday activities of the schools. Maybe it will be easier to understand the philosophy of the program if I name some topics which will be dealt with during these seminars for teachers. Psychosocial problems and learning difficulties of school children, children and their psychological war-related wounds, traumas and losses, resiliency, protective factor, natural resources of help, the protective and supportive role of school for mental health of students, the role of the teachers in child mental health protection, what can be done in the working reality of the school, cooperating with parents, developing voluntary work in the frame of the school, children's rights, creating synergies between school and community efforts for helping children, helping teachers to cope with their professionals and war-related difficulties, group work and role-playing. Beneficiaries will be a huge number of children. We think that in the frame of those 24 schools included in the program, about 2,000 to 2,500 children will in some way benefit from the program, some in a more intensive way, others in a milder way. We expect that the impact of the program will be reducing suffering and improving mental health and recovery of children, empowering parents also to help children, empowering teachers, and the development, I think this is particularly important, development of a local school-based model for mental health protection and the culture of mental health protection in the frame of the school system, and contribution to the mental health of children to the communities as a whole. And now I will like to conclude with a message. Dear teachers, I am aware, we are aware that even without our program, many of them, the majority of teachers are providing some assistance to children who have difficulties, who are emotionally affected. But In present times, this function and contribution of teachers and the school to the well-being of children is even more important, because children are particularly vulnerable for war impact, and on the other side, their families are often also so affected by war events that their capacities to support children is diminished. So please activate your knowledge and experience, your wisdom and goodwill, your capacities for helping children. The Slovene team will be honored to contribute to these efforts, and I am sure that together we will do a lot of good things and we will learn a lot each of us.